Hey everybody, it's springtime almost, and that brings up warm weather, windy, bright days, and a lot of pollen, especially here in Georgia. Today we're going to be talking about allergies and what you can do for them at home with over-the-counter medicines. You all know me, I'm Dr. B, and this is The Buzz. Now we all know that the immune system is used to fight infection. Unfortunately, sometimes the immune system can get a little too excited when it's exposed to things that it really should find harmless, like dust and pollen and dander and things like that. And when it does go a little bit haywire, you get symptoms of runny nose, itchy, watery eyes, sneezing. And that's what we call allergies. And when that happens, we call things like pollen and dander and dust allergens. And you can treat these at home without a prescription for the most part. We're going to talk about several classes of medications that you can get over the counter and use to treat these symptoms at home. We're going to talk about antihistamines that you would take by mouth. We're going to talk about nose sprays. There are antihistamine nose sprays and steroid nose sprays. And finally, we're going to talk about eye drops. There are eye drops that can help you with the itchy, runny, watery eyes. But first, let's talk about antihistamines. So when you have allergies, the body releases a lot of chemicals in the allergic reaction, called the allergic cascade is what we call it. The most common one that we think about that causes runny nose, itchy, watery eyes is histamine. And that's why the medications that block the effect of histamine are called antihistamines. And there are several that we use commonly in practice. I'm going to mention some brand names, but I'm not endorsing one over another. I will tell you which ones are useful for different situations. So let's go to the board. Now, the first one we're going to talk about is Benadryl. Benadryl is the brand name that you can get at the store. All of these come as liquid formulations so that kids can take them. Benadryl, the generic name is diphenhydramine, and you may see that in CVS brand or Publix brand, and it works just as well as the brand name. The duration of Benadryl is about 6 hours, and it does make you sleepy. The other thing is some kids, they get sleepy, other kids get kind of wired on it. So don't try it at bedtime and expecting the kid to go to sleep, because sometimes they will kind of get kind of crazy on it. But this lasts about 6 hours. It's very useful for some things like kid gets bit by a bee, your kid is exposed to grass and suddenly breaks out in hives, something like that. Or itching, you've had rolling around in the grass and you get a rash. You've been out in the woods, you get a rash and you're itchy. It's very useful for those kind of things. But because you have to take it every 6 hours and it's sedating, it's not one of those ones that we want to use all day. It's not a good idea. So there are some 24-hour medications, and let me write that in there. The duration of these is basically 24 hours. Same here, same here. Zyrtec or cetirizine. This one is not as sedating. So we'll just say it's less sedating than Benadryl. It still can make some people sleepy, but generally it's one that you can take. You take it at bedtime. If it makes you a little sleepy, fine, you'll sleep. Who cares? You're sleeping, so you're sleepy. Big deal. You can take it in the morning if it doesn't make you sleepy. For kids, generally we use 1 or 2 teaspoons either at bedtime or 1 teaspoon twice a day, depending on whether it makes them tired or not. Claritin or loratadine, that's also a 24-hour medication. This is supposed to make you even less sleepy. Now, there are some studies that say that's kind of a wash. It's about the same as Zyrtec. And there are some studies that say Zyrtec works better, or Zyrtec's better for indoor allergens. You just got to try and see which one works best for you. Allegra or fexofenadine, this is also a 24-hour one. This basically, you're probably not going to get sleepy on this. When I was in the Air Force, Allegra was the only antihistamine that they would allow the pilots to take because it didn't make them sleepy. Because it doesn't make you sleepy, this is probably a good one. If you want to take it twice a day, Allegra is probably what you're going to want to reach for. Allegra, the dosing is a little bit different, might be 30 milligrams, 60 milligrams twice a day. But you need to talk to your doctor about whether any of these are a good idea for you. I'm not endorsing any one over the other, just giving you the information. And then you can talk to your doctor about what you should do. Next, let's talk about nose sprays. Now, there are some nasal sprays that you can use for allergies. There's 2 main classes. One is nasal antihistamines, and the other one is nasal steroids. In the nasal antihistamine category, the only one I can think of I should just look this up, but the only one I can think of because it's very popular is Astelin nose spray, also called azolastine is the generic use. This works in about 15 to 30 minutes. It works for itchy, watery nose, runny nose, itching around the nose. That's great, because if you use it on the nose, that histamine is going right to the source of where the problem is. And it won't make you sleepy because it's a very small amount, just goes in the nose. One problem with just using that is it's not going to do anything for your itching skin. It's not going to do anything for your itching eyes for the most part. So you use this, and you might want to use also Zyrtec or Claritin or something like that. But that will work really fast, great medicine. The steroids, Flonase, Nasacort, and Rhinocort, fluticasone, this is a very popular one, Flonase or fluticasone, triamcinolone, budesonide, those are the other steroids. Steroids are for prevention, really. What they do is they cool off the nose, they cool off the immune system in the nose so that you're not releasing as much antihistamine. This will block the effects of antihistamine. This is for prevention to make you make less histamine in the first place. For someone with seasonal allergic rhinitis, these are actually the first line therapy. They're really great, but in kids, we don't usually get into them. And the reason is kids don't like sticking anything up their noses. And the other thing is if you use these and you don't use them exactly the right way, you might get a nosebleed. So when you put these in your nose, you got to aim them out towards the cheek. We say aim out towards the cheek, aim out towards the cheek. If you put it in like most people do and you kind of stick it like that, shoot it towards the center of your nose, it's going to probably either drip out or over time give you a nosebleed. So you need to be careful about that. There is one group of nasal medications that we do not use. And those are medicines that contain phenylephrine or oxymetazoline. And those medications are medications like Afrin or neosynephrine. The way that these medications work is they make the blood vessels in the nose constrict, and they're useful for congestion. They will decrease congestion, but the problem is if you use it for more than 3 days, they will actually make your congestion start to get worse, and you'll have to use them more and more often. So they are addictive. So we do not recommend Afrin, neosynephrine, those kind of medications, to use those at all. Now let's talk finally about eye drops for allergies. As far as eye drops go, we have 3 basic groups of eye drop medications that are over the counter for allergies. The first one, Zaditor and Aloe, those are 2 different brands, but they both contain ketotifen, which is the generic form. Zaditor, you'll hear me saying that in the office a lot. I love it. I use it. If my eyes are looking red after work, like they probably are right now, then I do like to use that to make them feel better. They have the ketotifen has 2 different properties. One, it's an antihistamine, and 2, it is a mast cell stabilizer. The antihistamine is going to work pretty quickly to get rid of the itching and the redness and the wateriness. Mast cell stabilizer is actually a preventive function. Works kind of like those nasal steroids. It's a preventive. This can be used every 12 hours if you need to. Pataday or olopatadine is strictly an antihistamine. Again, works fairly quickly. There is a 12-hour formulation. There's also a 24-hour one, which is supposed to last longer. And finally, you have Opticrom, which is cromolyn. This is strictly a mast cell stabilizer, which means it's really for prevention. I wrote that as use. It's preventive. So this is not what you're going to want to reach for if you are feeling some redness and itching right now and you want something that's going to work right now. This is really for prevention. Try one of the other ones instead. Now, just like with the nasal sprays, there are some medications we do steer clear of. And those medications work in the same way as those nasal sprays, neosynephrine and Afrin, that we kind of want to stay away from. And those are medications like Visine and Clear Eyes. These will get the redness out of your eye, but if you use them frequently or use them more than 3 days, they will actually be something that you have to use or your eyes are going to get a lot worse. So we do stay clear of those. We don't recommend ever using those for yourself or for your children. I want you and your kids to be able to get outside and enjoy the beautiful weather that we're about to have. Suddenly it turned colder today. I had to bring all my plants in again. I don't know what's going on, but I expect that we're going to have more warm days and more, it's like a weather report, more warm days and nicer weather. We're going to definitely have a lot more pollen. You can see it all over the cars already. So these are the kind of things that you can use. And I hope this has helped you to help get your kids feeling better so that you can get outside. I'm not sure what we're going to talk about next time, Probably something to do with newborns. We've had a lot of newborns in the office this week, and there are a lot of things to go over with newborns. So please follow or subscribe here or on any of this podcast sites. We're all over the place. And thanks for visiting. I'm Dr. B, and this has been The Buzz, Parenting in Pediatrics with me, Dr. B. We'll see you next time.